Let's get the awkwardness out of the way right now. If you are experiencing dryness, tightness, or discomfort in your intimate area, you are perfectly fine. You are not alone. This is not rare, and there is nothing to be embarrassed about. It is a physiological reality that the vast majority of women encounter after the age of 60. The problem is that almost nobody talks about it openly, and because of that silence, many women spend years enduring something that could have been addressed long ago. Think about it. You go to your cardiologist, you monitor your blood pressure, you keep tabs on your blood sugar levels. These things feel normal, routine, unremarkable, but the moment intimate health comes up, there is a pause, a silence, an awkwardness. As if that part of the body simply does not exist. As if after a certain age, it stops mattering. But it does matter. It matters at 60, at 70, and at 80. The intimate area is not just about physical closeness with a partner. It is about the bladder, about protection from infection, about comfort while walking, about restful sleep, and about everyday confidence. Today we are going to discuss all of this directly, calmly, and medically, without shame, without panic, and without unnecessary drama. Just facts, explanations, and specific actions you can start applying tonight. What women over 60 often overlook. A woman over 60 typically takes good care of her heart. She watches her blood pressure. She monitors her blood sugar. She thinks about her bones, takes calcium supplements, visits her orthopedist. She checks her eyesight, sees her dentist, gets her mammogram, and yet, at the same time, she completely ignores her intimate health. She doesn't visit her gynecologist, doesn't pay attention to symptoms, tolerates discomfort, stays silent. Why? Because she believes that after menopause, that chapter is closed, that this is just a normal part of aging, that complaining would be shameful, that the doctor will say, well, what do you expect at your age? I will say this plainly. If any doctor says that to you, you need a different doctor. Age is not a diagnosis. Age is not a reason to endure pain and discomfort. Age is a reason to pay closer attention to your body, not to give up on it. 5 misunderstandings that prevent women from getting better. Most women understand this problem in ways that are fundamentally incorrect. I say this not to hurt anyone, but because the wrong understanding is precisely what stands in the way of a real solution. Let us go through the most common misconceptions. The first misconception: this is old age, nothing can be done. This is the phrase I hear most often, and it is simply untrue. Yes, the body changes with age, but change is not a verdict. It is a process. Every process has specific causes, and if causes exist, so do ways to address them. Vaginal dryness after 60 is not the way things simply have to be. It is a condition that responds to correction. In many cases, it can be significantly improved, and in quite a few cases, it can be nearly eliminated. The second misconception: intimate health is only about sex. This is a serious misunderstanding. The intimate area is about the bladder, about protection from infection, about comfort during ordinary walking, and about sleep quality that suffers because of nighttime itching. When the mucous membrane thins, it is not just one area that suffers. Several body systems are affected simultaneously. The third misconception: a moisturizing cream will solve the problem. No, a cream is temporary relief. It eases the symptom for a few hours, but it does not address the underlying cause. It does not restore tissue. It does not return muscle tone. It does not normalize the microbiome. To genuinely change the situation, a systematic approach is required. The fourth misconception: hormones are dangerous. The word hormones frightens a great number of women. They cause cancer, they create dependency. Better not to touch them. I hear this constantly. In reality, hormonal deficiency after menopause is a medical fact. Not an opinion, not a theory, but the result of thousands of studies. And there are various ways to compensate for it, from pharmaceutical to entirely natural. The thing to be afraid of is not hormones, but ignorance. The fifth misconception: if there is no pain, everything is fine. Many women do not see a doctor because nothing hurts, but the absence of pain does not mean the absence of a problem. Tissue atrophy develops gradually. First, mild dryness, then discomfort, then micro tears, then infections, then chronic inflammation. Pain comes at the later stages, Waiting for pain before taking action is like waiting for a fire to start before buying a fire extinguisher. What is actually happening inside your body after 60? Everything begins with a single hormone, estrogen. Estrogen is the primary female sex hormone. After menopause, estrogen levels decline, a process that begins during perimenopause, around age 45, and continues for the rest of life. By age 60, estrogen levels can be 5 to 10 times lower than they were at age 30 to 35. That is a colossal difference. What does this mean for the intimate area? First, the vaginal mucous membrane loses moisture and elasticity. In a healthy state, estrogen keeps the mucosa moist, thick, and supple. It stimulates the production of natural lubrication. When estrogen is low, the mucosa thins and becomes dry and fragile. It is easily damaged by any mechanical contact, from underwear, from physical activity, from ordinary walking. Second, the acid-base balance is disrupted. In a healthy vagina, the environment is acidic, with a pH of 3.5 to 4.5. This acidic environment is maintained by beneficial bacteria, called lactobacilli, which produce lactic acid that suppresses the growth of harmful microorganisms. When estrogen is low, lactobacilli decrease in number. pH shifts toward alkaline, at 5 to 6 or higher, and protection weakens. Conditions arise for yeast infections, bacterial vaginosis, and chronic inflammation. Third, blood supply to the tissue deteriorates. Estrogen stimulates blood flow in the pelvic area. When it is low, blood vessels narrow, circulation slows, and tissues receive less oxygen and fewer nutrients. This accelerates atrophy, the gradual thinning, weakening, and shrinking of tissue. Fourth, the urethra suffers as well. The lining of the urethra and the vaginal lining share a common origin and are equally dependent on estrogen. When vaginal tissue thins, the same thing happens to the urethra. It becomes more vulnerable to bacteria. This is precisely why urinary tract infections increase so sharply after menopause. A woman treats cystitis with antibiotics. It clears up and then returns a month or two later, in a recurring cycle, because the root cause is not bacteria, but the weakened mucosal barrier. Fifth, the pelvic floor muscles weaken. This group of muscles supports the bladder, uterus, and rectum. With age and estrogen deficiency, they lose tone. Urinary leakage appears when coughing, sneezing, or laughing. A heaviness is felt in the lower abdomen. In advanced cases, organ prolapse occurs. All of these are not separate problems. They are links in a single chain. 5 hidden causes. Nobody told you about declining estrogen is the primary cause, but there are other factors that worsen the problem. Almost no one talks about them. Not doctors during appointments, not friends, not online articles. Yet these factors can be decisive. The first hidden cause is vitamin D deficiency. Most people know that vitamin D is needed for bones, but few know that it participates in maintaining mucous membranes throughout the entire body, including the intimate area. Research in recent years shows that postmenopausal women with low vitamin D levels experience significantly more severe vaginal atrophy than women with normal levels. Vitamin D deficiency is one of the most widespread nutritional gaps in the world, especially in people over 60, in regions with long winters and short daylight hours. The second hidden cause is omega-3 fatty acid deficiency. Omega-3 is not just a beneficial fat. It is a building material for cell membranes. When it is lacking, mucous membrane cells recover more slowly, tissues lose moisture more quickly, and inflammation that should resolve in a few days becomes chronic. Most women over 60 get critically low amounts of omega-3 from food, particularly when fish is rarely eaten. The third hidden cause is chronic stress. When the body is in a state of constant tension, the adrenal glands produce cortisol, the stress hormone. Cortisol suppresses the immune system, narrows small blood vessels, and reduces blood supply to tissues, including those of the pelvic region. If you are constantly anxious, have insomnia, or worry about health, family, or finances, your cortisol is chronically elevated, and this directly worsens the condition of the intimate area. Stress is not abstract, it is biochemistry, and it works against you. The fourth hidden cause is type 2 diabetes, or the condition that precedes it, insulin resistance. Elevated blood sugar damages small blood vessels and nerve endings, slows healing, and increases the risk of fungal infections. Many women do not even suspect they already have insulin resistance that is quietly damaging their tissues. If you have not checked your fasting glucose and glycated hemoglobin recently, do so. It is a simple blood test that can explain a great deal. The fifth hidden cause is a sedentary lifestyle. When you move little, blood flow in the pelvic area slows down. Pelvic floor muscles weaken more rapidly, tissues receive less oxygen, and the processes of recovery slow to a crawl. Yet one daily walk of just 30 to 40 minutes is enough to significantly improve blood supply to the pelvic organs. Not running, not the gym, simply walking every day. Now we move to what matters most: specific steps. What to do, how to do it, and in what order. All actions are divided into 5 directions. Each direction works on a separate link in the chain we discussed in Part 1. Only when you work across all 5 directions simultaneously does the result become lasting. Do not be intimidated by the scope. Each individual action is simple. Most require no money, no equipment, and little time. Together, however, they create a system that works. Direction 1. Moisturizing and improving circulation. Start with the most frequent and most noticeable symptom: dryness and thinning of the mucous membrane. Dryness is not merely an unpleasant sensation. It is a signal that tissues are not receiving sufficient nourishment and protection. Left unaddressed, dryness leads to micro-tears. Micro-tears lead to inflammation, and inflammation leads to infection. Use natural oils for local moisturizing. Cold-pressed, unrefined coconut oil without additives works best. It is safe for the mucous membrane, contains no chemical components, and has a mild antimicrobial effect. Apply a thin layer to the external intimate area once or twice a day, morning and before sleep. This will not eliminate the root cause, but it will provide immediate relief. You will feel the difference on the very first day. The skin becomes softer, the feeling of tightness disappears, and friction from underwear diminishes. Alternatives include sea buckthorn oil, which has pronounced regenerative properties, and evening primrose oil, which contains gamma-linolenic acid and restores tissue elasticity well. To improve circulation in the pelvic area, 3 simple actions help. First, daily walks of at least 30 minutes. Not fast running, not exhausting workouts, calm, measured walking in the fresh air. During walking, the pelvic muscles rhythmically contract and relax, improving blood flow to tissues. If you currently walk 15 minutes, add 5 minutes every 3 days until you reach 30 to 40 minutes. Second, breathing exercises. Sit comfortably, relax your shoulders and abdomen. Inhale slowly through your nose for a count of 4. Hold for 4. Exhale through your mouth for a count of 6 to 8. Repeat 10 times. This relaxes the pelvic floor muscles, relieves vascular tension, and improves blood flow. Third, warm sitz baths. Pour warm water into a basin and sit for 10 to 15 minutes, 2 or 3 times per week. Warmth dilates blood vessels and helps tissues receive more oxygen. On the subject of water intake, sufficient consumption of clean water is the foundation of internal hydration. If you drink little water, no external creams or oils can compensate for that deficiency. The body needs at least 6 to 8 glasses of plain water per day. Not tea, not coffee, not compote, but water. Tea and coffee have a mild diuretic effect and can actually worsen dehydration. Begin your morning with a glass of warm water on an empty stomach. Direction 2. Restoring pH balance. In a healthy vagina, pH is between 3.5 and 4.5. This acidic environment is maintained by lactobacilli, which produce lactic acid. After menopause, lactobacilli decrease and pH shifts toward alkaline. Protection against infection drops sharply. Before explaining what to do, let us be clear about what not to do, because mistakes in hygiene most commonly destroy pH balance. Never wash the intimate area with regular soap. Bar soap has a pH of 9 to 10. Every time you use it, you are eliminating the residual acidic environment and literally washing away your own protection. Never use antibacterial gels, soaps, or wipes. They destroy all bacteria indiscriminately, both harmful and beneficial bacteria recover more slowly than harmful ones. Never douche. Internal vaginal rinsing is one of the most harmful procedures a woman can perform on herself. It completely eliminates the microflora, disrupts pH for several days, and opens the door to infection. The vagina is a self-cleaning organ. Wash only the external area. What should you do instead? Use special intimate gels with a pH of 3.5 to 4.5. They are available at any pharmacy. Before buying, always check the packaging. The pH value must be listed. If it is not listed, do not buy it. Add fermented foods to your daily diet. Kefir with a short shelf life. It contains more live bacteria. Plain yogurt without sugar or flavorings. And home-fermented sauerkraut. Store-bought is often pasteurized and contains no live cultures. All of these provide probiotic bacteria that support the microbiome of the entire body, including the vagina. 1 to 2 times per week. Take a warm sitz bath with natural apple cider vinegar. 1 to 2 tablespoons per liter of warm water for 10 to 15 minutes. The vinegar gently acidifies the environment. Make sure it is raw, unfiltered apple cider vinegar. You should see sediment at the bottom of the bottle. Finally, probiotic capsules specifically formulated for women's health and containing lactobacilli strains are available at pharmacies and are particularly useful after a course of antibiotics or after recurring infections. Direction 3. Supporting hormonal balance, naturally. Estrogen decline is the root cause, and it affects not only the intimate area, but also sleep, mood, energy levels, the condition of skin throughout the body, joints, memory, and concentration. What can be done without pharmaceutical hormonal therapy? Vitamin D. If your level is below 30 nanograms per milliliter, this is a deficiency that needs to be corrected. Ask your doctor for a 25-hydroxyvitamin D blood test. If the result is low, you will need vitamin D supplementation at a dosage of 1,000 to 4,000 international units per day, depending on the degree of deficiency. Take it with fatty food, as it is fat-soluble and absorbs best with oils or nuts. Omega-3 fatty acids reduce systemic inflammation in the body, support cell membranes, and improve blood supply to tissues. The best dietary sources are fatty sea fish, salmon, mackerel, sardines, and herring. Include them in your diet 2 or 3 times per week. If you do not eat fish or eat it rarely, take fish oil capsules at a dose of 1 to 2 grams per day. Look for preparations that list the EPA and DHA content. These are the active forms of omega-3. Vitamin E is a powerful antioxidant that helps restore mucous membranes and reduces dryness. It is found in almonds, avocado, cold-pressed olive oil, and sunflower seeds. For additional supplementation, capsules at 200 to 400 international units per day are suitable, but consult your doctor before starting, especially if you take blood-thinning medications. Phytoestrogens are plant compounds that structurally resemble human estrogen. They do not fully replace it, but they can partially compensate for the deficiency and gently support tissues that depend on this hormone. The main sources are ground flaxseed, 1 to 2 tablespoons per day, added to morning porridge, yogurt, or salad. Legumes such as lentils and chickpeas included in the diet 3 to 4 times per week, and soy products such as tofu and soy milk 2 to 3 times weekly. Adaptogens are plant-based preparations that help the body handle stress and gently support hormonal balance. 2 of the most well-studied for postmenopausal women are Peruvian maca, which improves energy, mood, and supports libido, taken as a powder or capsules at 1.5 to 3 grams per day, and ashwagandha, which lowers cortisol levels, improves sleep quality, and reduces anxiety, taken in capsules at 300 to 600 milligrams per day. Both adaptogens are best taken in courses, 2 to 3 months on, then a 1-month break, and always after consulting a doctor. Direction 4. Correct hygiene. Intimate hygiene. After 60 is not the same as at 30 or 40. Tissues have become thinner, more sensitive, and more vulnerable. What caused no problems before may now irritate and damage. The rules need to be reconsidered. And that does not mean hygiene should become complicated. On the contrary, it should become simpler. Fewer products, fewer procedures, less aggressive intervention. But each action must be correct. Never rub the skin with a towel after washing. Instead, blot gently with a soft cloth. Any rubbing can traumatize the thin mucosa and cause micro tears through which bacteria enter. Avoid intimate moist wipes. The vast majority contain alcohol, fragrances, preservatives, and other chemicals that irritate sensitive skin and disrupt the microbiome. Wash only the external area, the outer and inner labia. Never attempt to rinse the vagina internally. Wear only cotton underwear. Synthetic fabrics do not allow air to pass, create a warm, moist environment, and encourage the growth of fungi and bacteria. Cotton breathes, absorbs moisture, and keeps the skin dry. At night, sleep without underwear or in a loose cotton nightgown, without tight underwear underneath. Night is the time when tissues should breathe and the body should recover. Many women who begin following this one simple rule notice a reduction in itching and irritation within a week. Wash underwear at a temperature of at least 60 degrees Celsius. Lower temperatures do not kill fungi and bacteria. Avoid fabric softener. Its chemical components remain on the fabric and can irritate the skin. If you use daily panty liners, for example due to mild leakage, choose only cotton ones without fragrances or plastic layers, and change them every 3 to 4 hours. A liner that stays in place all day creates a greenhouse effect and becomes a breeding ground for bacteria. The best alternative is to strengthen the pelvic floor muscles so that liners become unnecessary. Direction. 5. Strengthening the pelvic floor muscles. The pelvic floor is a group of muscles that forms the base of the pelvis and supports the bladder, uterus, and rectum. When they weaken, urinary leakage appears, a heaviness is felt in the lower abdomen, and in severe cases, organ prolapse occurs. By age 60, these muscles are weakened in nearly every woman. But the good news is that they can be trained, and results come relatively quickly. The primary exercise is the Kegel exercise, developed by American gynecologist Arnold Kegel in the mid-20th century, and confirmed effective by dozens of studies. To perform it, sit comfortably in a chair or lie on your back. Relax your abdomen, thighs, and buttocks. Now, imagine you want to stop the flow of urine. Contract exactly those muscles. You should feel a squeezing and a slight upward lifting sensation in the perineal area. Hold the contraction for 5 seconds, then slowly release for 5 seconds. That is 1 repetition. Do 10 to 15 repetitions. That is 1 set. Perform 2 sets per day, morning and evening. Total time, no more than 5 minutes per set. Important rules. Do not hold your breath during the exercise. Breathe freely. Do not tense your abdominal muscles. The abs should remain relaxed. Do not squeeze the buttocks, and do not press the knees together. Only the perineal muscles should work. If you are unsure you have found the correct muscles, try stopping the flow of urine once during urination. The muscles you contract are the pelvic floor muscles. Do not do this regularly, just once as a test, since routinely stopping urination can disrupt the normal bladder reflex. After 2 to 3 weeks of consistent practice, you will notice the first changes. Better control when coughing or sneezing, and a reduction in lower abdominal heaviness. After 1 to 2 months, improvements will be significant. After 3 months, many women report that mild urinary leakage has almost completely disappeared. Once the basic exercise feels easy, add progressions such as the elevator, gradually contracting the muscles as if rising floor by floor, holding at the top for 3 to 5 seconds, then descending gradually, and rapid contractions, 1 second on and 1 second off for 20 repetitions, which train the quick response muscle function needed when coughing or sneezing. The key rule is regularity. Do this every single day without skipping. Pelvic floor muscles, like any other muscles, weaken without exercise and strengthen with consistent training. Even 5 minutes twice a day is enough to start the recovery process. The exercise requires no equipment and can be done anywhere. At home, on public transport, in a queue, on a bench in the park. No one around you will notice, but the results will be enormous. If I could give a woman over 60 just one recommendation, it would be this. Do your Kegel exercises every day. Strong pelvic floor muscles mean not only bladder control, but support for all pelvic organs, prevention of prolapse, improved circulation, confidence, and peace of mind. Now, it is time to bring everything together into a single, simple, concrete, and achievable plan. One that you can start tomorrow morning. We will also look at when to expect the first results, what mistakes almost every woman makes, in which situations you must see a doctor, and what to do if you are not sure where to begin. Your daily protocol: morning, midday, and evening. The morning routine begins the moment you wake up. The first action is a glass of warm water on an empty stomach. Not hot, not cold, but warm. This activates your metabolism, stimulates the intestines, and begins moisturizing the body from within during the very first minutes of the day. Drink it 15 to 20 minutes before breakfast. The second morning action is breakfast with phytoestrogens. Prepare porridge, oatmeal, buckwheat, or millet, and add 1 to 2 tablespoons of ground flaxseed. If porridge is not your preference, plain yogurt without sugar works well with flaxseed and a handful of almonds. You can also have half an avocado on whole grain toast. The goal is to give your body phytoestrogens, healthy fats, and vitamin E from the very start of the day. The third morning action is taking your supplements. With breakfast, take vitamin D, omega-3 in the form of fish oil capsules, and vitamin E if your doctor has recommended it. All of these are fat-soluble and absorb best alongside food containing fats, which is precisely why it is important to take them with a meal rather than on an empty stomach. The fourth morning action is the first set of Kegel exercises, 10 to 15 contractions held for 5 seconds each, with 5-second releases between them. Sit comfortably after breakfast, and it takes no more than 3 to 4 minutes. You can also add 5 to 10 rapid contractions of 1 second on and 1 second off. That completes the morning portion of the protocol, a total of no more than 20 to 25 minutes, including breakfast. You are not adding special procedures to your day. You are simply improving the content of what you already do. Instead of a cup of tea on an empty stomach, a glass of warm water. Instead of toast with cold cuts, porridge with flaxseed. Instead of scrolling your phone after breakfast, 3 minutes of Kegel exercises. The midday block is the time for movement and nutrition. Take a walk of 30 to 40 minutes. The pace should be comfortable, but not too slow. You should feel a slight increase in breathing rate, but be able to speak freely. If the weather is poor, walk at home, through rooms, along the corridor, or even in place. What matters is moving every day. 2 to 3 times per week, include legumes in your lunch, chickpeas, lentils, or beans in a soup, a puree, or a salad. On other days, eat fish, salmon, mackerel, sardines, or herring. If fresh fish is unavailable, canned fish in its own juice is suitable. The goal is regular intake of omega-3 and phytoestrogens from food. Throughout the day, drink at least 4 to 5 glasses of water in small portions, without waiting to feel thirsty. If you feel tension or anxiety midday, take 10 deep breathing cycles. Inhale through the nose for 4, hold for 4, exhale through the mouth for 6 to 8 counts. This lowers cortisol, relaxes the pelvic muscles, and improves circulation in just 3 minutes. The evening block is the time for restoration and preparation for sleep. When washing, use an intimate gel with a pH of 3.5 to 4.5. Wash only the external area. Gently blot with a soft cotton towel. No soap, no rubbing. 2 to 3 times per week, take a warm sitz bath for 10 to 15 minutes. Once or twice a week, add a tablespoon of a natural apple cider vinegar per liter of water. After bathing or washing, apply a thin layer of coconut oil or evening primrose oil to the external intimate area. This creates a protective film, reduces friction, and maintains tissue moisture overnight. Then perform the second set of Kegel exercises, 10 to 15 contractions held for 5 seconds each. Many women find it comfortable to do these lying in bed. Add the elevator progression, gradually tighten through 3 levels, hold at the top, and release gradually. 5 to 7 repetitions. Finish with 10 deep breathing cycles to lower cortisol and prepare the body for sleep. Finally, sleep without underwear or in a loose cotton nightgown without tight underwear underneath. Let the tissues breathe. When to expect results? I will answer this honestly, without embellishment. In the first week, you will notice that dryness has diminished somewhat thanks to the oils and hydration. Sleep may become slightly deeper thanks to the breathing exercises and the absence of tight underwear at night. General comfort in the intimate area will improve. These are small changes, but they are important. They show you that the process has begun and your body is responding. In weeks 2 and 3, dryness will become noticeably less pronounced, and irritation from underwear will decrease. If you have had mild leakage problems, you will notice better control when coughing and sneezing, the first results of the Kegel exercises. Many women at this stage also report having more energy during the day, as the omega-3 and vitamin D begin working. Between 1 and 3 months comes the period of stable, deep change. The mucosa becomes noticeably more moisturized and elastic. The frequency of inflammation and infections decreases significantly as pH balance begins to restore, and the microflora moves toward a healthier state. Mild urinary leakage may completely resolve. Mood stabilizes, sleep becomes consistent and deep. You will feel that you are managing the situation rather than the situation managing you. 3 mistakes that prevent almost every woman from getting results. The first mistake is waiting until things get worse. This is the most common error. A woman feels mild dryness and thinks, it's bearable for now. When it gets really bad, I'll deal with it. But atrophic changes progress. Tissue that is slightly thinned today will be more significantly thinned a year from now. Muscles that are slightly weakened today will be weaker still next year. Restoring tissue at an early stage is simpler, faster, and more effective than at a late one. Every month of delay is lost time. I have seen women who came in 6 months after the first symptoms. 2 months was enough for them to feel significant improvement. And I have seen those who came after 10 years. They needed 6 to 9 months and pharmaceutical support. The difference is enormous. Act at the first signals, not the last. The second mistake is treating symptoms rather than causes. Buying a dryness cream is fighting a symptom. Taking antibiotics for yet another urinary infection is fighting a symptom. Using panty liners for leakage is fighting a symptom. All of these are temporary measures that do not solve the problem. They mask it, while the underlying problem continues to develop. This is like repainting rust on a car without treating the metal underneath. Beautiful on the surface, while the destruction continues from within. True resolution means working on causes, restoring the mucosa, strengthening muscles, normalizing the microbiome, correcting vitamin deficiencies, and improving circulation. That is precisely what the 5 directions address. The third mistake is feeling embarrassed and staying silent. This is perhaps the most serious of all 3. Women do not speak about the problem. They do not tell their doctor because they are embarrassed or afraid of hearing, "Well, what do you expect at your age?" They do not tell their friends because the subject is considered indelicate. They do not tell their partner because they do not want to appear weak. And as a result, they live for years with discomfort that could have been addressed. They endure for years what they do not need to endure. They believe for years that this is just how things must be. It is not. And the first step toward a solution is to stop being silent. Warning signs that require a doctor's appointment. Everything discussed in this material represents steps you can take independently. But there are situations in which seeing a doctor is essential. Not in a month, not when you find time, but within the next few days. 7 warning signs require prompt medical attention. First, any bloody discharge from the vagina. After menopause, there should be no bloody discharge. If it has appeared, this is not a reason for panic, but it is an unambiguous reason to be examined. Causes can range from atrophy to more serious conditions, all of which require assessment. Second, sharp sudden pain in the lower abdomen or perineal area that does not subside for several hours. Acute pain is always a signal that cannot be ignored. Third, unusual discharge, greenish, gray, foamy, or with an unpleasant pungent odor. This may indicate an infection requiring laboratory diagnosis and appropriate treatment. Fourth, recurring infections. If yeast infections, bacterial vaginosis, or cystitis return 3 or more times per year despite treatment, you need a doctor who will identify the underlying cause and create a long-term treatment plan, rather than simply prescribing another course of antibiotics. Fifth, a sensation of a foreign body in the vagina, or a pronounced feeling of prolapse. This may indicate pelvic organ prolapse, descent of the vaginal walls, or internal organs. Early diagnosis and treatment are critically important in such cases. Sixth, urinary leakage that does not improve after 3 months of regular Kegel exercises and is worsening over time. Additional treatment methods that only a doctor can prescribe may be required. Seventh, any new growth, thickening, or non-healing sore in the intimate area that was not present before. Anything new and unexplained should be shown to a doctor. It is far better to be cautious and hear everything is fine than to miss something important. Remember, early medical attention is always simpler, faster, and safer than delayed. The complete action plan at a glance direction. 1. Moisturizing natural oils for external care: coconut, sea buckthorn, or evening primrose. At least 6 to 8 glasses of water per day, and warm sitz baths 2 to 3 times per week. Direction 2. pH balance restoration. Eliminate regular soap and douching. Use an intimate gel with a pH of 3.5 to 4.5. Add fermented foods every day: kefir, yogurt, sauerkraut, apple cider vinegar baths once or twice a week, and probiotic courses. Direction 3. Natural hormonal support. Vitamin D based on blood test results, omega-3 from fish or in capsule form, vitamin E from food or supplements, phytoestrogens from flaxseed, chickpeas, lentils, and soy, and adaptogens such as maca and ashwagandha in courses after medical consultation. Direction 4. Correct hygiene. A gentle intimate gel, blotting rather than rubbing, cotton underwear, sleeping without underwear, no moist wipes, washing underwear at 60 degrees, and external washing only. Direction 5. Pelvic floor muscle strengthening. Kegel exercises twice per day every day, 10 to 15 contractions held for 5 seconds, with the elevator progression and rapid contractions added as you advance. Look at this list once more. There is nothing extraordinary in it. Coconut oil costs very little. Flaxseed is sold in any grocery store. A walk is free. Kegel exercises are free. A glass of water is free. You do not need to purchase expensive programs, sign up for special courses, or visit a clinic. Everything you need is already available. You simply need to begin. Do not try to implement everything in one day. This is a common mistake: getting inspired, trying everything at once, and quitting after a week because it feels like too much. Instead, add 1 or 2 new habits each week. In the first week, start with warm water on an empty stomach, the oil, and Kegel exercises, 3 simple actions requiring no purchases. In the second week, add daily walks and flaxseed at breakfast. In the third week, add the sitz baths and the correct intimate gel from the pharmacy. In the fourth week, add vitamin D and omega-3. After 1 month, you will be following the entire protocol, and it will feel natural and simple, because it is simple. You will barely notice as these actions become part of your day, as habitual as brushing your teeth. You have listened, engaged, and tested yourself against these ideas. That means you are ready for change. And when you are ready, change will come. If any symptom from the warning list applies to you, please do not wait. Book an appointment with your gynecologist. Do not be afraid to go, and do not hesitate to ask questions. You have the right to know what is happening with your body and to receive proper care. All the information presented here is educational in nature. It does not replace an in-person consultation with your doctor and cannot be used for self-diagnosis. Every body is individual. Before making any changes to your diet, routine, vitamins, or supplements, especially if you have chronic conditions or take medications, consult your doctor. Take care of yourself. Your body is the only one you have. Be well.